Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 23 new cases of COVID-19 in Windsor and Essex County. Of the 23 cases, 5 are outbreak-related, 3 are close contacts of confirmed cases, 5 are community-acquired, and 10 are still being investigated. We have had 13,037 cases since March of 2020. 12,370 cases are now resolved and 280 people are active at this time. 44 confirmed cases are currently in the hospital and 7 people are in ICU. Our community has lost 387 people to COVID. Unfortunately, we are reporting 5 new deaths today, all people from our community. 2 men in their 60s and 3 women in their 80s. 236 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 11 active outbreaks in Windsor and Essex County, 2 long-term care and retirement homes, 2 community outbreaks, 5 workplace outbreaks, and 2 hospital outbreaks. We are currently in Phase 1 of Ontario's 3-phase COVID-19 vaccine distribution plan. 11,569 individuals from Windsor-Essex County have now received both doses of a COVID vaccine. Yesterday, 144 people were vaccinated at our targeted community clinic for Windsor-Essex County residents over the age of 80. The City of Windsor has done a great job transforming the WFCU Centre into a welcoming vaccine site for our seniors. Our pre-registration system is on our website, and people can also call 519-251-4072 to pre-register. We encourage as many residents as possible in this age group to work with family and friends to access our website to complete this pre-registration or actually call. As of this morning, we have approximately 11,800 people who have pre-registered. Those who call in should be prepared to have a bit of a wait. We encourage residents to visit our website, the vaccine webpage, for further information at wechu.org and click on the COVID-19 vaccine button. Whether you are vaccinated or not, please continue to follow public health measures. Stay home if you're sick. Limit your close contacts to your household members. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning. I would just add that as we continue to do our vaccination, just a reminder again that we have a long list of people who have self-registered at this time. We are going through the list as quickly as possible, and we'll continue to schedule people for vaccination. Please be patient with us, and those who are getting the vaccine, please continue to follow the public health measures. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
I'm just curious, when the Leamington site comes on and the appointments are randomly selected, if people from Windsor or anywhere in the community are willing to drive to Leamington, are those appointments open to anyone, or how will the process work once the Leamington site comes online?
So we are having those internal discussions and trying to make sure that we are comfortable with the process. So today we have a meeting right after this to determine how we want to move forward with that. And the random selection, we want to make sure it's fair, but we also realize it will not be suitable for someone who is living in Windsor if they have an appointment in Leamington, that we're adding further transportation issues. So we are looking at that process, and I know the people that are working with the scheduling, they're trying to figure that out. Our epidemiologists and our planning people. So more will follow, and I hate to, comment any further until they've had their ability to walk through it and determine how the process will work and how that randomization will occur.
Okay, that's all for now. Thank you.
Okay. Any questions from AIM 800?
Dr. Ahmed, I know you touched on this briefly yesterday when we talked in the afternoon, but can you just, and I know you said more details will be shared later this week, but when it comes to the homeless in our community, can you just talk about what the plan is for the vaccination process for our homeless community?
Thanks, Rob. So right now, what we are doing is we're in the process of collecting that information from the agencies who are serving these homeless population. We know that quite a few of them are already in isolation at the city-run IRC, as well as the Adelaide Farm IRC, where some of these individuals are isolating. So they are being followed. We have a list that we are trying to work with, and we know that quite a few of them will go to the aquatic center. So we are trying to work on the logistic of, first of all, identifying all these individuals, and then trying to work on a plan that would allow us to give them the first dose of the vaccine as well as the second dose of the vaccine. We're also looking for some ministry guidance in terms of the timing of it, because we want to make sure that most of these individuals, as best as our ability, should be able to get 2 doses of the vaccine just like anyone else. So we're working on it, and hopefully we'll share more details, as I said, later down this week. But we recognize that this would be a group which is difficult to track, but we'll do our best to make sure that we follow up with them and try to work on a plan that would give them more chances to complete their 2 doses of vaccine.
Are you hoping, and I know you said you're going to share more details, but are you hoping to begin the vaccination process fairly soon for that population?
Well, that's the plan. We're just looking for some final details from the province before we move forward. Right now, we are in the stage of collecting all that information, but as soon as some of those details are worked out, we plan to move as quickly as possible.
And then one final one here, just in regards to the variant. I know a release was sent out last night. Any updates in regards to the variant? I know you said it could take up to 2 weeks. Has the health unit received any additional information on those cases that were the variant in that possible case at the long-term care home?
Yeah, so Rob, a great question. Unfortunately, I haven't seen any updates on the variant. Typically, if we receive the sequencing results, my team definitely shares with me. I will try to connect with the Public Health Ontario lab as well, because it's almost close to 3 weeks already. So I haven't received anything, but I'll follow up.
Thank you very much.
Any questions from CTV?
Yes, good morning. Just wondering, how long can you keep up with the current pace of vaccinating with the current supply levels?
So we are, we are getting like a steady supply of Moderna. So we just, from what we know for the next couple of weeks, that we will have vaccine to administer vaccine in Leamington and Windsor. But that could change. So we will just stay on top of it as much as we can with what we know today. And we do know that the next couple of weeks we can rely on, the amount of vaccine that we were told we were going to get allocated for this area. That can change, and hopefully it will be ramping up, and we'll go from there. But right now we're scheduling according to what we know today, and if that changes, we'll relook at everything and change as well.
And do you have any updates on possible mobile vaccination clinics, especially for migrant workers, or, you already mentioned the homeless?
So we continue to talk about the priorities for vaccination and the different methods of delivery. And right now we are focused on over 80, and we're actually trying to determine what other options for those over 80, because not everyone will be able to go to a vaccination site outside of their residence. So we are looking at how we can, work with getting the over 80 population vaccinated in areas where they're all together, like in a residence of some sort. So with the agri-farm workers, and we will also be working on getting everyone vaccinated, but the actual details have not been determined, but we expect to work with our partners at Erie Shores Healthcare and Essex Windsor EMS to provide vaccinations as well when we're able to.
Okay, thanks. And just one more question on any updates on asymptomatic testing in schools.
Dr. Ahmed, do you want to answer that, or do you want me to?
Sure, yeah, I'll answer. So we have shared some of the additional data with our school boards with respect to where these schools are that can be deemed as high risk. And we are working on a process for them, because it's an initiative by the Ministry of Education. So the school boards are working with the Ministry of Education and probably a third-party vendor to arrange all these asymptomatic testing at the school site. Public Health, Windsor-Essex County Health Unit are providing that level of details that they need to develop their program. So it's in the works right now, and I don't have a set start date, but they are talking to the ministry and also with the third-party vendor to initiate the asymptomatic testing in a timely manner.
Okay, great, thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. Good morning, Teresa. My question is regarding volumes at the vaccination clinics, volumes of seniors being vaccinated. Chatham-Kent vaccinated over 2,000 seniors over the weekend, and I know that the health unit is going to be doing smaller daily volumes when both clinics get going. I'm wondering if you can shed some light on why that is. Does it have to do with the current supply of vaccines?
So I'll start, and if Dr. Ahmed wants to add to it. But for our strategy, we do know that we were looking at up to 2,000 doses every week. And so that's how we've planned our clinics. So I'm not entirely sure what the allocation for other regions are. We also know that we have Windsor Regional Hospital is also vaccinating as well. So they are doing additional people that are healthcare workers on the prioritization list. So we have a couple different groups being vaccinated at the same time. So, and we're sharing the allocations. So, we developed a process that will, use the vaccine that we have, and we have made it a very safe experience for our seniors. If we ramp it up based on our immunization of getting, I don't imagine we would be doing with the senior population, making it 1,000 a day at the WFCU. I think that is more our strategy for when we're vaccinating the general public. So right now, even if we get increased vaccine, we would look at our numbers and make sure that the process and the flow aligns with maintaining all of the public health measures and getting the people vaccinated, based on our layout and doing it safely. But I'm not sure how, what occurred in Chatham, but I did hear that they had completed 2,000 over the weekend.
Thank you. I also wanted to ask about the vaccine rollout for people with developmental and intellectual disabilities. Is there a rough timeline of when those vaccinations would be taking place?
So I'll just answer that. We are waiting and hoping for more direction regarding the transportation of the vaccine and how that gets delivered. So we've talked a little bit before about the challenges with the current vaccine. So we are using Pfizer right now. That's all we have in our community. And Pfizer has to be reconstituted and also be, in a deep freeze and can't be transported. So we don't have the ability to vaccinate people one shot at a time. And so we'll continue to, as we get more information, more access to other vaccines, we'll continue to develop our plans and vaccinate people as we can using the best method of delivery and the safest transport for the vaccine. So regarding timelines, we are just moving as quickly as we can and using the vaccine in the most responsible way that we're able to prioritize at this time.
Any further questions from Blackburn?
No, thank you.
Amy 100?
Teresa, just for clarification, so just want to make sure, so the vaccination is happening currently in Windsor-Essex right now at the WFCU Center. Like you mentioned, the hospital is taking care of the predetermined list there for that was announced last week with different offices and healthcare staff. And then is there still vaccinations taking place at long-term care and retirement homes?
So we are doing very little at the long-term care and retirement homes because we have completed as much as we can. And in saying that, though, there are always new people attending the homes, and we are trying to figure out how we deliver the vaccine to any new residents. So I would say that we're never going to be completely done in the retirement homes, but you're right, the majority, everyone has been completed, the residents, the staff, essential caregivers. But as new people come back into the homes or are transferred back, we're trying to figure out how we maintain keeping everyone vaccinated. And again, it's to deal with the actual vaccine and the logistics of the vaccine and the fact that it's not just a single dose. It can't be transported that way. We're looking at, with Pfizer, 6 doses at a time. And with the residents of the long-term care homes, we've used Moderna. And that's a 10 to 11 dose vial. So right now we're continuing to work with the homes, and one of our directors described it as a very kind of like doing a complicated Sudoku because it's a little bit of a challenge trying to figure out these doses and keep the vaccine, make sure it's being transported and delivered the way it's meant to be.
I'm not sure if you can share these details, but I know the freezer donation that happened last week. With the site in Leamington opening next week, I know you have an office in Leamington. So will there be a freezer at the arena in Leamington, and is there a freezer at the WFCU Center, or does the vaccine have to get transported from your offices?
So we maintain the security and the safety of the vaccine in our offices, and the transportation of the vaccine is on a daily basis to the vaccination site. So no vaccine is kept on site at the WFCU Center, and nor will it be on site at the Nature Fresh Farm Recreation Center. We will deliver it. They have fridges for us that because the vaccine will be thawed and then administered, but the frozen vaccine is maintained at our sites.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
No, thank you.
Thank you, everyone. Have a great day.